We're living in an age of extraordinary scientific progress. The tools to prevent, detect, and treat diseases have never been more advanced. Breakthroughs once out of reach, like rapid COVID vaccines, advanced cancer therapies, and AI for earlier disease detection, are now shaping the future of healthcare. Yet for people living in many low and middle income countries, essential medicines are often unavailable or unaffordable. Insulins made 100 years ago, or new antibiotics, are far from the reach of people who need them the most. Health systems are under-resourced, and effective treatments that are standard in high-income settings are still out of reach for many. This inequity is the greatest global health challenge of our time. My name is Jayashree Iyer. I'm the CEO of the Access to Medicine Foundation. Our mission is to push the boundaries of what access to medicine looks like. We analyze, benchmark, and influence the world's largest pharmaceutical companies on not only what they promise to do, but also what they actually deliver for patients living in low and middle income countries. Health products are still not designed with global equity in mind, and clinical research remains concentrated in very few countries around the world. If we truly want to address access at scale, more diverse populations need to be included in these clinical studies, so that eventual products are truly benefiting the patients who need them the most.
More than 80% of the global population live in low and middle income countries, yet most of the clinical research done in the world is done elsewhere. And this means that these communities are underrepresented in the quest for new innovation and new medicines. We're here today at the Masiphumeleli site of the Desmond Tutu Health Foundation. This is one of our clinical research sites where we have been working on HIV and TB for more than 2 decades. The clinical research we've done here, particularly looking for new antiretroviral treatments and pre-exposure prophylactic interventions, has benefited local communities. This work has been done in partnership with individuals who could benefit most from these new medications. We really do need research for a variety of oncoming epidemics, non-communicable diseases, in particular thinking about cancer, sickle cell disease, diabetes. And for this, we need the communities that are most affected to be involved right from the beginning. We're talking about young people, people who are vulnerable, pregnant women, really who can benefit from new innovation. Those are the individuals who need to be involved in the design and the execution of the clinical research. The Access to Medicine Foundation supports this shift through very important research and data. For example, encouraging pharmaceutical manufacturers to do more of their clinical research in centers such as this. And together we've been able to increase the opportunities for new medication, new interventions, life-saving treatments like antiretrovirals and prevention modalities such as pre-exposure prophylaxis. In addition, by working with pharmaceutical industry, Access to Medicine Foundation has encouraged the sharing of licenses with medicines patent pool, and of course, overall that increases our access to medication and changes public health and outcomes for regions such as ours here in South Africa.
Stigma and discrimination around HIV are still very common where I come from. I've been using PrEP from last year. At first, I had to take 1 pill every day, which wasn't always easy. Sometimes you worry that someone might find out and you end up missing a dose. And now I use an injection every 2 months. It's more discreet, it fits my life better, and it feels like I have more control. We need more of this. We need systems that protect us. With the right support, research, and access tailored to our needs, things can change.
When a new medicine is developed, it still needs to be registered, approved, and eventually reimbursed. This is a process that can take years. Without this, the product cannot be sold, distributed, supplied, and even prescribed. Entire communities are left without access. In order to change this, we need to see stronger policies, better regulatory systems, and more political will. For this, governments, pharmaceutical companies, and local actors need to work together so that change is happening from the ground up. At the end, it's about a community health center being able to stock the right medicine. It's about a mother being able to receive the right treatment for her child. From lab to factory to clinic to patient, every step matters. At the Access to Medicine Foundation, we work with companies, governments, investors, and global health actors to transform research insights that we develop into real, meaningful, sustained action. By tracking performance, identifying best practices, and showing what works and what doesn't, we inform institutional investors who invest trillions of US dollars in the pharmaceutical industry to make informed decisions that drive change in companies they invest in.
As investors, we aim to invest in companies that are contributing to and benefiting from sustainable development. The companies we invest in, particularly those in the pharmaceutical sector, play a direct role in people's health and well-being. That means we, as investors, have the ability to influence these companies in how they operate in their sector and how they widen access to medicine in the world. Sustainable investment isn't just about mitigating risk. It's about driving long-term value. That means asking companies what they are doing to ensure that the life-saving treatments they develop are being made available and affordable where they are needed most. We look for companies integrating access planning into their business model, so growth in new markets is aligned with the needs of consumers. For example, investors are paying closer attention to where and how companies are doing their clinical research and building their manufacturing facilities, because that's where access begins. The earlier that scale is built into the system, the better the outcomes for patients and investors. The data and insights from the Access to Medicine Foundation help guide our conversations with companies. They indicate the quality of company management and the resilience of its business model, and enable us to push for greater transparency, stronger commitments, and meaningful action. Because aligning financial returns with positive social impact is both good business and the right thing to do.
Health equity is possible. We've seen what happens when the world acts with urgency, coordination, and purpose. HIV infections have fallen where people had access to antiretroviral therapies and prevention tools like PrEP. We've seen cervical cancer deaths fall where HPV vaccines have reached girls early, and childhood deaths have declined, where routine immunization have been made a priority. The impact is real, but it's not reaching everyone. That's why we need to do better and do more. Because access to medicine should not depend on chance or on where someone happens to be born. It's time to turn commitments into action, and together, make access to medicine a reality for everyone, everywhere.